And cost and access remain a major barriers. What practical advice do you have for navigating insurance approvals, step therapy, and patient assistance programs?
Yes, this is always an issue. But there's many manufacturers. They have patient gateways and other methods to help obtain medications. They have bridge programs. So often, sometimes it's navigating it through prior authorization and appeals processes. But luckily, there are ways to get through those hurdles, especially for the patients who really need it.
Hmm. For clinicians, what are one or two common misconceptions or outdated practices in psoriasis care that you wish would disappear from routine practice?
I think some misconceptions. A big one is patients will often come in with loved ones and say, "Oh, is this contagious? Is my child going to get this? Is my spouse?" It is not contagious. This is immune-mediated disease that's really based on the genetics and in the environment, but not contagious. So that's definitely a myth and a misconception. Another misconception is that this is because of something one's eaten or some kind of trigger that's related to diet. So that's another misconception that although it's important to have a healthy diet for the comorbidities, there's no food triggered psoriasis. So that's often a misconception. Another misconception is that it's because of one's hygiene and then that they're dirty, but this is not the case at all. So those are some of the misconceptions that I do see with the one about being contagious, the most common.
So, once a patient has been treated, because patients have maybe different skin types, people's outcomes may vary. What are some of the things that you have faced when it comes to that post treatment kind of maintenance phase? What do you see most often?
Yeah, this actually ends up being a very big issue and very important to patients because once we have the psoriasis cleared, right, the thick, um, maybe itchy, burning plaques, there's often left, especially when people have different skin tones, a different shade of skin. So we see post inflammatory hyperpigmentation, which is darkening of the skin, post inflammatory hypopigmentation, which is a lessening of the color of the skin relative to the surrounding skin, or we see in for periods of time post-inflammatory erythema, which is a pinkness to the skin. So the plaque may be gone, but there's also these color changes, and that can be very upsetting to patients. So, I do address these, and often in certain patient types, I want to treat very aggressively early on because we see that this, what we call PIPA or pigmentary alteration, can be minimized when we have aggressive therapy upfront, reducing all that inflammation and that cascade of inflammatory markers, and then improving the skin pigmentation issues in the long run.
Mhm. And when we've talked a little bit about other factors such as smoking and things like that. How do conversations about diet or vitamins and nutrients, like how does that come into play? Is that something that you end up talking to your patients about, or something that has an impact on their psoriasis at all?
Patients will bring it up because sometimes they maybe believe that some kind of elimination diet may help with their psoriasis. So I do not agree with elimination diets or anything that's very drastic. I advise on being healthy, which is with diet and exercise to maintain an appropriate BMI or body mass index. Um, and that's just gonna improve one's weight, the comorbidities, associated cardiometabolic risk as well.
Mm. Looking ahead, what emerging therapies or research directions in psoriasis, pathophysiology, and treatment are you most excited about?
It's very exciting to the point where we have come already with these targeted approaches. So continuing to have these really safe, efficacious medication treatment algorithms that reduce treatment fatigue, reduce the burden of disease, and just improve quality of life is really exciting. this psoriasis affects 2 to 3% of the population. There's so many people affected by it, with variation of disease from mild to severe. So, and there's no cure. So, really being able to target treatment and have them work for long periods of time, and decrease the burden of disease is very exciting. And also just all the work that's being done on oral options is very exciting as well.
Hmm. If you could leave us, patients or and physicians, with kind of just some parting words about psoriasis care, and communication, what would it be?
I would probably say that psoriasis is common. For patients, you're not alone. There's a lot of other people who are also have this. I'd say it's not contagious. And also for patients and clinicians, I would say that we have remarkable medications now, and we can really achieve clear to almost clear skin and improve patients' quality of life.
Wonderful. Well, it's been a pleasure having you on MD Newsline podcast. Thank you so much for joining us.
Thank you so much for having me.